Healthcare in the United States may be slightly different from the healthcare system and services offered in your home country. One of the main differences is that the U.S. has no universal access or nationalized healthcare, meaning you will need to pay for the medical services you receive. Having a private insurance plan, like a Wellfleet student health insurance plan, helps you to receive and cover costs associated with care. To help you better understand, in this lesson, we'll dive into some common terms, services, and coverages. Health insurance helps reduce or even eliminate costs associated with healthcare, like routine, urgent, and emergency doctor visits, x-rays, or surgeries. While coverage varies by plan, health plans typically include premiums, deductibles, co-pays, co-insurance, and out-of-pocket maximum. These are the fees that the member, in this case you, are responsible for paying. Let's quickly define each, so you can get a better idea of what they are. Premium, the amount of money you pay to purchase your insurance plan. It may be included on your tuition bill. Deductible, the amount of money you pay in a year for most services before insurance will start contributing to the remaining balance. Not all services have a deductible. Copay or copayment, the per visit or per service fee members are expected to pay for certain covered medical expenses, like doctor visits or prescriptions at the time of service. Co-insurance, a percentage of your covered medical expenses you're responsible for paying. The co-insurance takes effect after you've met your deductible. Out-of-pocket maximum, the maximum amount you will pay in a plan year for covered medical expenses. Once you've met your out-of-pocket max, your health plan will pay for 100% of your covered medical expenses. Now that you know a little more about your financial responsibility, one of the most important things you should know about your coverage is where you should go when you are sick, injured, or in need of therapy. Because care needs are so diverse, you can choose from many different types of providers, which may be confusing. Plans like ours work with groups of doctors, hospitals, and other healthcare specialists throughout the country to ensure you can get the help you need at discounted rates. These groups of providers are referred to as Preferred Provider Organizations or PPOs, and these providers are considered in-network. By going to an in-network provider, you are often able to receive care at a lower cost than if you go to a non-PPO provider, more commonly referred to as an out-of-network provider. Out-of-network providers can still provide you with quality care, but you may end up paying more out of pocket. If your school has a student health center, this should be your first stop for services ranging from care for mild sicknesses or sprains to infections or minor injuries. If your school does not have a student health center, a local primary care doctor or telehealth visit can be a simple and cost-effective solution. Urgent care facilities or walk-in pharmacy clinics can also assist, often without an appointment and during nights and weekends. These facilities may result in higher out-of-pocket costs than a traditional doctor's office visit. For most emergency needs, like heart attacks, traumatic injuries, overdoses, or severe bleeding, you should call 911 and visit an emergency room. With ER visits, you can expect relatively high out-of-pocket costs. In addition to where you can seek care, it's important to know what is covered. Covered services can include routine medical, behavioral health, or emergency visits. Non-covered services tend to be cosmetic in nature. It's important to understand what your insurance plan considers covered and non-covered. You can find what your health plan covers in your Wellfleet student app by navigating to My Health Benefits. If you're unsure what care you need and where to find it, start by contacting your campus health center. You can also check your Wellfleet student mobile app to find out what coverages you have, where to find an in-network provider, and what your estimated cost of care will be. If you have an urgent mental health issue, your plan may include access to Care Connect, a 24/7 behavioral health hotline, which is available through the Wellfleet student mobile app. Additionally, your plan may include access to NurseLine, which provides 24/7 access to a registered nurse, and it can help direct you to the appropriate level of care. There's a lot more to learn about how student health insurance works. Continue in the next lesson to learn more about your care and coverages.